Hi viewers, I'm Dr. Neelam. I previously told you about what are the types of diabetes and how it presents and how can we diagnose it. Now in this part of video, I'm going to tell you once you're diagnosed with diabetes, how could you manage it and what you should do to achieve the glycemic targets and how you're going to follow. So once you are labeled diabetic, you are diabetic for life. You can only control it, you can't cure it. Type 1 diabetes and type 2 diabetes are managed in two different ways, because type 1 diabetes is a diabetes where the subject is insulin depleted. So from day one they will be on insulin. They will be on a basal and bolus regime or any other regime will be tailored according to their requirements. That will be done by their consulting physician or doctor. So that is very important to understand. In type 2 diabetes, first we can give them lifestyle modification, that is diet, regular walk, and subsequently only diet and walk if not sufficient to control their blood glucose, they will be put on medication. So now what exactly they should eat? See, every patient should have their individual tailored diabetic diet chart, which will depend on their height, weight and their food habits and their physical activity. So specific formal diet chart of some calories is given and individually given by a dietitian to a patient, which should be strictly followed, because if there are a lot of fluctuations in there, or they are having erratic meal timings or quantity, then they are going to have a lot of fluctuation in their glycemic record also, which we don't want. Second most important pillar of management of diabetes is regular walk. They should at least dedicate 30 to 45 minutes 5 days a week, for minimum 4 to 5 days a week, and that should be 45 minutes daily. They should have a regular walk and they should cover at least 3 to 3.5 kilometers. Only word of caution is those who are cardiac patients, had recent angioplasties, they should at least defer it for 3 to 4 weeks, and they should consult their cardiologist, and after they are allowed for it, they should go for regular walk. Now the question arises, can type 1 diabetic patients do physical activity? Of course they can do. They are allowed to do all kinds of physical activity. And they should do, actually. That improves their glycemic control. And this also reduces weight. So your insulin resistance also is better controlled and the same medicines are able to act better. So diet, walk, and then finally comes medicine. And for medicine, you should be very, very regular and you should understand the clear instructions given by your doctor or physician or a specialist, that some group of medications are to be taken before meal, some are to be taken after meal. And those who are on insulin, the site of insulin, like it should be injected in abdomen, at least 3 fingers away from your umbilicus. These small tips, these are very important because this will regulate your sugar. Then your target should be, pre-meal sugar should be between 90 to 130, post-meal 2 hours, blood glucose should be between 140 to 180. HbA1c should be kept less than 7%. And you should also have annual formal testing for complications for diabetic retinopathy, nephropathy. All these are very essential, because no matter how good control you are managing, please allow your doctor to see your records and give you proper advice. So 3 monthly minimum you should see your doctor despite having good glycemic control. So please follow all these advice, and any confusion, please let me know. Either if you want to consult online, you can go to Lybrate site and have online consultation. And if you want to see me in my clinic, you can drop into Gurgaon. Thank you very much for giving your valuable time.